Hello students, in this class today we'll discuss about classification of disability, physical disability, mental retardation, visual impairment, hearing impairment, speech impairment and its causes, functional limitations and characteristics. Disability is the consequence of an impairment that may be physical, cognitive, mental, sensory, emotional, developmental, or some combination of this. A disability may be present from birth or occur during a person's lifetime. Disability, as we all know, is an umbrella term covering impairments, activity limitations, as well as activity restrictions. It is essential to understand what each of these terms exactly means. Impairment is a problem in body function or structure. An activity limitation is a difficult encountered by an individual in executing a task or action, while a participation restriction is a problem experienced by an individual in involvement in life situations. Thus, disability is a complex phenomenon reflecting an interaction between features of a person's body and features of the society in which he or she lives. There are various types of disability as described in the list. Number 1, physical disability. Number 2, sensory disability, which includes vision impairment, hearing impairment, olfactory and gustatory impairment, somatosensory impairment, balance disorder. And number 3, intellectual disability. Number 4, mental retardation and emotional disability. Number 5, pervasive developmental disorders. Number 6, developmental disability. Number 7, non-visible disabilities. Number 8, speech impairment. The list is very long. In this particular text, we will be discussing about physical disabilities, mental retardation, visual impairment, hearing impairment, speech impairment and the causes, functional limitations and characteristics. Not every impairment which limits the physical function of the body is necessarily a physical disability. Physical disabilities include impairments which limit activities of daily life such as respiratory disorders, blindness, epilepsy, and sleep disorders. It is a limitation on a person's physical functioning, mobility, dexterity, or stamina. It permanently prevents normal body movement. Let us now discuss the causes of physical disability. Prenatal disabilities are acquired before birth due to disease or substances that had harmed the mother during pregnancy, embryonic or fetal development accidents, or genetic disorders. Prenatal disabilities are acquired during birth due to prolonged lack of oxygen, premature birth extra. Postnatal disabilities are gained after birth due to accidents, infection, or other illness. Some other causes of physical disabilities are: 1. Some of them are inherited or genetic. Number 2. Conditions present at birth. Number 3. Serious illness affecting the brain, nerves, or muscles. Number 4. Spinal cord injury. 5. Brain injury. Functional limitations. Physical disabilities may result from permanent injuries to the brain, spinal cord, or limbs, which prevents proper movement in parts of the body. Different physical disorders create different functional limitations in the body. Spina bifida causes partial or full paralysis of the legs, bones and joint deformities, curvature of the spine, and difficulties with bowel and bladder. Children with cerebral palsy may have difficulties with posture, movement of body parts or the whole body, muscle weakness or tightness, involuntary muscle movement, balance and coordination, and eating and talking. Some children with physical disabilities may also have some other disabilities. They may also have communication difficulties. Characteristics. Physical disorders are characterized by any bodily ailments which hinder the proper functioning of the different body parts. They may be acquired before birth, during birth, or after birth. They may also be genetic. Now, let's discuss about mental retardation. Mental retardation is a subtype of intellectual disability. This disability may appear at any age. A mental disorder is a psychological or behavioral pattern generally associated with subjective distress or disability that occurs in an individual and previewed by the majority of the society as being outside of normal development or culture expectations. A person is considered intellectually disabled if he or she has an intelligence quotient less than 70 to 75. The most common causes of mental retardation are: 1. Genetic conditions which include like Down syndrome and Fragile X syndrome. 2. Problems during pregnancy. 3. Problems during childbirth. 4. Illness or injuries. Infections like meningitis, whooping cough, or measles can lead to intellectual disability. 5. Severe head injury, extreme malnutrition, exposure to toxic substances. 6. Severe neglect or abuse. 7. Iodine deficiency. 8. Absence of the arcuate fasciculus. Its functional limitations are: a person with intellectual disability, that is mental retardation, has limitation in two areas. Firstly, intellectual functioning, also known as intelligence quotient. This refers to a person's ability to learn, reason, make decisions, and solve problems. Second, adaptive behaviors. These are skills necessary for day-to-day life, such as being able to communicate effectively, interact with others, and take care of oneself. Children with intellectual disability learn more slowly than a typical child. People with severe or profound intellectual disability need more intensive support and supervision their entire lives. Characteristics. It is different from mental illness like schizophrenia, depression, etc. Intellectual disability is considered to be and referred to as a disability rather than a disease. It may appear at any range. They may be caused due to natural as well as man-made situations and reasons. It is characterized by below-average intelligence or mental ability and a lack of skills necessary for day-to-day living. It makes the living capacity and speed of a person slower than normal. It delays oral language development and adaptive behavioral skills, difficulty in learning social rules and solving problems, deficit in memory skills, etc. This is a subtype of sensory disability. It refers to vision loss of a person to such a degree as to qualify as an additional support need through a significant limitation of visual capability resulting from either disease, trauma, or congenital or degenerative conditions that cannot be corrected by conventional means such as glasses, medications, or surgery. Its causes are: 1. Visual impairment can be due to disease, trauma, or congenital or degenerative conditions. Number 2, eye disorders such as retinal degeneration, albinism, cataracts, amblyopia, glaucoma, etc. lead to visual impairments. Number 3, corneal opacification. Number 4, diabetic retinopathy. Number 5, retinitis pigmentosa. Number 6, retinopathy of prematurity. Number 7, Stargardt's disease. Number 8, uveitis. Number 9, age-related macular degeneration. Number 10, accidents. Functional limitations. People with visual impairment face varying degree of problems depending on their visual demands. They have to depend on external support and aid in order to complete their daily tasks. Those with worsening sight and the prognosis of eventual blindness are a high risk of society. There is hindrance in communication between visually impaired and normal people. There is lack of facial expressions, body gestures, dependency, look of disengagement or detachment in visually impaired people. Characteristics. It is characterized by reduced vision not corrected by spectacles or contact lenses. It is distributed unequally across age groups. It can either be by birth or after birth at any point of a person's lifetime, both by natural and man-made conditions. Studies show that in every region and in every age group, females have a higher risk of being visually impaired than males. And now let us discuss the hearing impairment. This is another subtype of sensory disorder. Hearing impairment is a category of physical impairment that refers to conditions in which individuals are fully or partially unable to detect or perceive at least some frequencies of sound which can typically be heard by most people. It exists when there is diminished sensitivity to the sounds normally heard. Its causes are: number 1, genetics. Number 2, age. Number 3, exposure to noise. Number 4, illness. Number 5, chemicals. Number 6, physical trauma. Number 7, neurological disorders. Number 8, medications. Number 9, neurobiological factors. Functional limitations. In children, it may affect the development of language and can cause work-related difficulties for adults. People have difficulty in hearing conversation, localizing sound and understanding speech in the presence of background noise. People with hearing loss have problems socializing with people around. One of the main limitations of hearing loss is its impact on the individual's ability to communicate with others. This exclusion from communication can have a significant impact on everyday life, causing feeling of loneliness, isolation, and frustration. It can have adverse effect on the academic performance of children. Apart from the individual level, hearing loss substantially affects social and economic development in communities and countries. Characteristics. It refers to both partial hearing loss can be prelingual and postlingual. It can also be unilateral and bilateral. Hearing loss increases with age. It may result from genetic causes, complications at birth, certain infectious diseases, chronic ear infections, etc. may cause social exclusion. Speech impairment is a type of communication disorder where normal speech is disrupted. This can mean stuttering, lips, etc. Someone who is unable to speak at all due to a speech disorder is considered mute. Its causes are: number 1, stroke or progressive illness. Number 2, damage to the nerves or brain, head or neck injuries, surgical accident. Number 3, Parkinson's disease. Number 4, cerebral palsy. Number 5, neurological pathologies such as brain vascular accidents, brain tumors, craniocephalic traumatisms. Number 6, drug abuse. Number 7, vocal abuse or misuse. Functional limitations. Speech impairment causes inconsistent production of speech sounds. Production of words become more difficult. It deprives an individual's particular speech of its characteristics. Some impairments, that is muteness, also causes complete inability to speak. Speech sound disorders creates difficulty in producing specific speech sounds. It poses difficulty in learning to produce sounds physically and the sound distinctions of a language. Characteristics. Classifying speech into normal and disorder is a problematic task. Only 5% to 10% of the total population has a completely normal manner of speaking and healthy voice. All others suffer from one disorder or another. It may include partial impairment to complete inability to speak. It can be acquired before birth or after birth, at any point of life and at any age. Stuttering, a kind of speech disorder, affects approximately 1% of the adult population. As discussed in the previous sections, it is clear that disability is thus not a health problem. It is a complex phenomenon of reflection of the interaction between features of a person's body and features of the society in which he or she lives. To overcome the difficulties faced by people with disabilities, interventions are required to remove environmental and social barriers. People with disabilities have same health needs as non-disabled people for immunization, cancer screening, etc. They may also experience a narrower margin of health, both because of poverty and social exclusion, and also because they may be vulnerable to secondary conditions such as pressure sores, urinary tract infections. Evidence also suggests that people with disabilities face barriers in accessing the health and rehabilitation services they need in many settings. Thus, in addition to medical aid, social help should also be provided so as to help them to become independent, develop self-confidence, and ultimately help them to lead a socially and economically productive life.